The phases of oxygen therapy are not always what you might expect. Low blood oxygen levels, known as hypoxemia, can affect anyone, regardless of age, gender, culture, or community. Everybody needs oxygen, but some bodies need a little extra to live and stay active. This is one person's story about how they use oxygen for life.
Hi, I'm Colleen, and I was diagnosed with pulmonary arterial hypertension back in 2007. Before I was diagnosed with pulmonary arterial hypertension, or I'll just call it PH, I had a wonderful career. I was raising a small, young family. My children were 3 and 7, and things were pretty great. We were going on vacations. We were super active with our family, and things just were going kind of the way we thought they would with life. I first realized something was probably wrong with my breathing after I had my daughter. I just couldn't keep up with other people. I can remember distinctly, we were in New York City and Grand Central Station's escalators stopped working and everyone had to take the stairs. And here I am with hundreds of people trying to go up the stairs, and people of all shapes and sizes and ages, and I couldn't get up the stairs and I needed help. And when I got to the top, I needed to stop for like 10 or 15 minutes to catch my breath. And I just thought, wow, of all these people, what is up with me that this is not working out for me? And frankly, I was shocked because, I'd been an athlete growing up. And even prior to having my children, I was very active and I could pick up and run a couple miles without any major effort. And so it was pretty shocking to me that suddenly I couldn't keep up with anyone. I couldn't walk and talk at the same time, or walk and chew gum. It just wasn't happening for me. When I was first diagnosed with PH, I had to go on oxygen immediately, which was a major shock to me. So I'm in my 30s. You need to do a lot of character building, I think, to have the confidence to leave your house and try to continue to live your life. When you're wearing oxygen, there's a lot of questions potentially. Um, but I had a respiratory therapist come to my house, and I didn't even request it. The durable medical equipment supplier just sent one. And I was so grateful because I didn't know what to do. So this gentleman taught me, here's the concentrator, here's how it works, here's what you'll use when you leave your house, here's how you change tanks, here's how I want you to think about cooking more safely, here's safety measures I want you to take when you're traveling with oxygen tanks. And most importantly, he told me, there's a better solution for you. It's called liquid oxygen, and I highly recommend you switch to a company that can offer that for you, because it's going to help you be more portable based on the oxygen requirements that you have. So I've always been on at least 4 to 6 liters with activity. Really, for my 6-minute walk, 15 liters per minute. But I try to manage my real life in 4 to 6 liters. Liquid oxygen gave me the ability to still do things with my family that I didn't know were still going to be possible. So I was able to throw a backpack of oxygen that only weighed 5 pounds, that's liquid, and hop on a bike and teach my kids how to go bike riding, or bike ride with them on the boardwalk. And I was able to go for walks on the beach with them. And really, the liquid oxygen gave me so much independence. Things were just easy for me because it was lightweight, it was portable. I could do so many things on my own, which I appreciated because prior to my diagnosis, I was pretty fiercely independent. So I started to hear rumbling that the liquid system might go away. And I think I'd been through a consolidation a time or two where my company was bought by another company. And ultimately, it was when I went through breast cancer treatment, and I didn't leave my house for a year and a half. I was just trying to survive. That the oxygen company, I think, was sold, and like literally the manufacturing, the plant with the liquid, the trucks, the personnel, everything was gone, and I then was stuck without a provider for liquid oxygen. And I did try to call, at least 30 or 40 companies to try to find liquid oxygen. Even companies that I knew were servicing some of my friends. And they would tell me that they didn't have liquid oxygen. And they would tell my care team, they would just deny their request for my liquid oxygen. And basically, people just said, we're not offering it anymore. And I spoke to management and some of the companies, and some people took it up to higher levels for me to see if they might be able to get someone to change their mind. But it was always a firm no, that they were getting out of the liquid oxygen business. I've been devastated that liquid oxygen has been taken away from me. I feel as though I just can't understand, frankly, how a doctor's prescription can be changed by a durable medical equipment supplier. And I do understand it has to do with reimbursement. So I think our government has definitely a hand to play in this as well. The durable medical equipment suppliers, the government reimbursement for Medicare, and the insurance providers, I think all three of them are culpable in making me have a life where I can't do many of the things that I used to be able to do before. And not only that, they've gone an extra measure in limiting the amount of time that I can leave my house. I can only leave my house for 14 hours a week based on the number of tanks that the durable medical equipment supplier chooses to give me. Well, my daily routine doesn't change too much when I'm at home. I am on oxygen 24/7. So I'm always hooked up to my oxygen concentrator. And I will say that now that I'm limited in going out of my house, I really need to be thoughtful in how I'm going to spend those 14 hours a week. What do I have planned? How many doctor appointments do I need to get to? How long does it take to travel there? How long will I be tied up there? What other commitments do I have? And I need to think about that. And it's difficult when you think about the choices that you need to make and the things that you might miss with your family based on other people telling you how much you can leave your house. So, when I'm in my house, not so much of a change, but I'm kind of strapped down to my house for the most part, right? I'm not sure someone who's not on oxygen can imagine what it's like for them not to be able to leave their house based on what the current policies are. It's just outrageous. So when I need to leave the house, I need to think about how much activity or exertion I'll be having. Will I be sitting? Will I be standing? Will I be walking? What exactly will I be doing so that I know what my demands will be? I know a lot of people have a set oxygen prescription. Mine fluctuates somewhat based on the nature of my condition. So I need to really think through how much oxygen I'll need, how many hours I'll be. I need to look at a chart to see how long each tank will last me. So for example, an E tank might last me at 6 liters a minute, like 2 hours, 1.9 hours to be exact. So I'm always referring to these charts to make sure that I bring enough with me. Unfortunately, I used to be able to go places and do things on my own. And now when I need multiple E-tanks, it's really difficult for me to do that. I try to go to the supermarket and shop for my family. And in spite of having been an athlete, it's difficult to push a cart full of groceries and try to pull an E-tank behind you. So what that means is I either have to have someone come with me, or I don't go to the supermarket anymore and I try to have my groceries delivered. I cannot go into the ocean. And I haven't been able to do that since my kids were 3 and 7 when I went on oxygen. And that hurts. I hope maybe someday I'll be able to find a way to do that again and dive into a wave. But that's what I wish I could do. I would say it had really improved my shortness of breath. Without having the oxygen on, I would feel tired and depleted, and I couldn't think straight. And it's probably pretty clearly because there's a lack of oxygen going to my brain. I definitely feel better when I'm wearing the oxygen. And when I don't wear the oxygen, especially when I move, my heart rate can really go quite high if I don't have the oxygen on. So I choose to wear it because I want to just be as healthy as I can and be here for my family. Recently, I figured out how to put my oxygen, and this now I have a tank, but I was able to get a super sturdy kayak, and with the support of others, right? Get into a kayak, have my oxygen behind me, and in a protected area where it's not, certainly not in the ocean. I'm in a quiet part of the bay that's protected by barriers. But I was able to get out there and my arms still worked, and I was amazed and I was thrilled. And it was really exhilarating to be on the water because that is something that I have not done maybe in 20 years. And I just kept thinking, I'm doing it. I'm doing it. And I don't know why it didn't occur to me sooner to try to do it, but you definitely need to have the right support. I made sure I had ropes for people to pull me in if I couldn't do it. And so just take the safety measures you need to. But if you have a dream, figure out how to make it work. Your loved ones will support you. Oh, I would love if healthcare professionals knew more about oxygen therapy. I think that there's so much they don't know about the current state of oxygen. I think that there's a lot that they don't know about the portable oxygen concentrators, that maybe they could guide patients better in terms of what might be most suitable for them and what's certainly not, and safe places to maybe purchase. I think outside respiratory therapists I don't think that our care teams understand the implications when you're in the hospital or when you first go on oxygen. What it means when they send out a fax to different suppliers and the first one responds, and then that first supplier who delivers oxygen we're married to now for 5 years, and that they receive a fraction of what they did, a decade ago to support us in the first 3 years and barely anything the last 2 years. When I'm around physicians in some of the volunteer work that I do, they always thank me and they're always surprised. Like they forget what it means and the complications of the daily life of someone who they put on oxygen. Every time I'm in a group of physicians, they say, "Thank you for reminding us." The general public should know that when people are wearing oxygen, first of all, they're already struggling with some underlying illness that is making them or their body not process enough oxygen. Overall, if you don't wear it, it impacts your heart and your brain and your other organs. I used to need to tell my children when they came home from school if they found me sleeping in an odd place, what to do. Like call 911 if I'm sleeping at the top of the stairs or somewhere weird, like on the kitchen floor. Fainting is a very real possibility. Oxygen is so important to safeguard us and our health. Please don't judge us. We need it, and oftentimes we could use a hand. When you see us in the supermarket parking lot, please do offer to return our cart and other things of that nature. It means the world to us. And on a day when, you can't think straight or it's hot outside, we might have just used the last bit of energy that we have. So please don't judge us and please support us where you can. The fact that policy has put me under house arrest is just unbelievable to me, and it hurts, and it's real. Basically, I feel like I'm being separated from my family because I can't go outside. I can't do these things, and it's not because of my pH. It's because the system won't give me the oxygen to leave my house. You are reimbursing oxygen, which is a medical prescription, like it is a bedpan, and it is not. We need a patient bill of rights. We need to have the ability to get the oxygen, which is medicine for our lungs, that we need. And it just blows me away that it's come down to a poor policy that I think has been a big misunderstanding that we all need to work together to correct. And that includes CMS, that includes the insurance providers, and the durable medical equipment suppliers. And I think all three of these entities really need to come together and figure out how to make it right for patients again. If it was one of their loved ones who was going through this, I think they would understand it much better. So I'd like for them to really lean in and understand what they're doing to families and to individuals who are trying to do their best to be good members of society and to give back. And they're really throwing us to the sidelines and telling us that we're not worth it. There's an act that's currently in Congress that can help us. It's called the SOAR Act, the Supplemental Oxygen Access Reform Act, and it's a bipartisan act, and it's supported by legislators who believe that there's an issue here. They understand the issue. They can see that less and less people over the last decade are using liquid oxygen and oxygen overall because they're being denied from it. And I look forward to the things that this act will do for us, giving us a patient bill of rights, which will give us really puts doctors back in charge of what our oxygen prescription is and give us what we need as opposed to what's convenient. It'll also give us access to a respiratory therapist, which is critical, I think, for anyone new going on oxygen. Things are just being dropped off and they're not being educated on how they can move forward safely and how they can still live their lives. Also, the access to liquid oxygen for those who it's medically necessary, so that people who are, especially on higher liter flows, can leave their house safely. This act will also make prescribing a little bit easier for clinicians, while also protecting the system from abuse. So this piece of legislation is really will help us start to turn the wave back towards what is good for patients, because for so long, maybe the last 20 years, it's been going the other way. You know, patients are suffering. Patients are dying from this. Patients I know are stuck in the hospital because when their care team sends out a request to DMEs, they all deny them, especially if they're higher flow. And they do that because they're not reimbursed. But these people are living in the hospital instead of being able to go home and be with their families. I don't know how much crueler the system could be. For those who are going on oxygen therapy, I want to tell you to, number one, please comply with it. Figure out what your why is. It's important that you do this for yourself. Have some grace with yourself and with your loved ones who don't understand it. Know what your why is, why you are going to wear this, what is important to you. And oxygen is not the end. I've been on oxygen for 17 years, and I will say that I've done my best to thrive, and I think my entire family and community will tell you that I have thrived in that time. So you could still go on vacation. You could still do things. You're going to need some support, and you're going to need to do some more planning, but anything that you want to do, you can probably still do on oxygen. Keep your chin up, keep the oxygen on, figure out your why, and just do it for you.